How do we move forward? Especially in a world of decreased funding and projected workforce shortages in the future. These are some trying times for us because we need to do more with less. As many of you know, whether you're in academics or in private practice, it's extraordinarily difficult for us. And what we really have to do is to relook at how we see the health system. And as you know, all of that's being revalued today. We're looking at how we can reward outcomes rather than piecemeal work. We're looking at metrics that are appropriate for population health. How to keep a population healthy. How can I reward providers? Today, there's very little economic incentive for providers to do that because there are very few dollars. We've really evolved to a system where, for me, as a general vascular and trauma surgeon in the old days, I made a very good living putting people back together after they did stupid things. Shot each other, stabbed each other, domestic violence, car crashes, drunk drivers, drug deals gone bad. You show up in the emergency room, in a trauma center, you have a pulse, I can save you. But I can't save you from yourself, because chances are when I tune you up and treat you, you're going to go out and do those same behaviors. And that really is the inherent problem. A lot of the disease burden, even as it relates to cardiovascular disease, which is the heart of the matter today, really is about these behaviors, these aberrant behaviors, the way we choose our life. And again, pharmacists are in a perfect position to be health coaches. So when we talk about pharmacy and with this legislation, I mean, I see really even a bigger role for pharmacy, a much more expanded scope of practice. You have the tools, you have the knowledge to be able to mentor. You have the tools to be able to follow patients, to guide them. And as it's been pointed out already today, you see more patients than just about anybody else. But when I talk about this too, it's not only pharmacists. What about EMTs and paramedics? Shouldn't they be? I mean, when they go into somebody's house and see bad conditions and they see the wrong food, shouldn't we be teaching them how to interact and ensure that patients are plugged into a system that values pursuing optimal health and wellness? So we can't afford any longer to just have a public health department deal with those things. It's my humble opinion that each and every one of us have to become public health providers with the skills and the scope of practice we have, and where necessary, expand the scope of practice. Because the silos have to come down, folks. You know, each special interest group wants to hold on with what they own, but that's not in the best interest of the American public. And over the years, I've worked, you know, as a doc, as a nurse, as a paramedic, as an EMT, and you see the silos go up, and people want to protect their revenue streams. But we can't afford to do that anymore. We have to turn this around and say, what skills do all of us have that can actually be directed to reduce cardiovascular mortality for sure, but how do we do it? We can write another report, we can talk about, you know, the healthy people reports and everything, but if you don't have agents of execution, if you don't have pharmacists at the front line actually dealing with these issues, having in their back pocket the right handouts, the right information, the tweets, the, you know, social media, all of that stuff has to be used, this, depending on the generation you're dealing with, then the reports just stay on the shelf and they become aspirations. That we want to drop smoking by 30%, or we want to drop high blood pressure, and so on. We need to arm and we need to empower every single person in the country who has the ability to do this to be an agent of execution around health. And again, who better suited to do that than pharmacists who are engaging patients almost on a daily basis. We don't lack the science, but we do lack the effective translation. I often used to tell groups when I would speak to them around the country that the research pipeline is now constipated. It's not that we don't need more research, but we're not effectively using the stuff that's coming out. When it takes 15 years to get a drug to market or a scientific idea to market, I mean, what's going on here? This is not in the patient's best interest. And so when you actually look at this, look at it very critically, we see the importance of what you've been trying to do. I can remember a decade ago when you all kindly honored me with being an honorary pharmacist. I made very similar comments at that meeting. Why aren't you all doing something more? Why are you just being pharmacists? I mean, it's a great profession, but you're engaging the people. And then it wasn't in the public consciousness. It's taken us a decade to get here, maybe longer. But I remember those were some of the remarks I had back in early meetings with you all. And now we're finally here, and it's legislation, but it's still going to take probably another number of years, if not a decade, before it becomes part of our culture that pharmacists are critical parts of our health system.